Stress, hormones, perimenopause, anxiety, thyroid, each one of those is a name, literally, for women's sleep apnea. It's the name that they're given before anyone tests for the sleep apnea. And it's not because your doctor has missed the obvious, but it's because the test was actually built around how it shows up in men. So today we're going to talk about the 8 hours that nobody has ever looked at.
Welcome to the True Wellness Podcast with Dr. Z, where we explore what it takes to live with vitality, balance, and purpose. I am Dr. Z, and each week I will bring you powerful tools, inspiring stories, and expert insights to help you thrive in every area of your life. From health and wellness to mindset and navigating life's challenges, this podcast is your guide to creating a life of true well-being. Now, let's get started.
You're probably wondering why I'm talking to a dentist about why you're exhausted. That's the right question. It's most of the reason I wanted to have this conversation today. So Dr. Layne Martin has spent his career on Airway, the space you breathe through while you're actually asleep. He teaches it. He spent years in dental sleep medicine, and he builds appliances literally around it. And the mouth is where this first shows up, often years before anyone thinks to even order a sleep study, which means that your dentist may have been looking at the evidence for a decade without either of you really knowing what you were looking at. So, Layne, thank you so much for being here and for sharing your knowledge and wisdom. You know, the Airway piece is a really big piece. I know, my own kids have started, services for working on their Airway, but this is one of the fundamental things that gets missed. And we can do all the right things that we're supposed to do, but if we're not addressing the airway, if we're not getting the rest, if we're not getting the sleep, the body doesn't heal and repair. So help us dive in and understand, what is Airway?
So first of all, I don't even know if you need me after that intro because it was so great the way you described so many of the issues. And, I always say now when I lecture, I have the unique value prop of failing in so many aspects of dentistry. And I was a restorative dentist in Manhattan, and I sold my practice at the age of 42 to go back to school to do orthodontics and craniofacial orthopedics around what you were talking about, airway and sleep. So just backtrack a little bit. As a dentist, the thing that I missed for 15 years was people that are clenching and grinding. And so much of what we do in dentistry and medicine is what we treat symptoms. No one's looking at the root cause problem. Someone comes in with severe wear on their teeth. I'm like, all right, you need a night guard, or you need all your teeth fixed and restored, rather than not asking the question, why does that person look the way they do?
Right.
And I was at fault for it for a long time. And, I think that's something, the easiest thing for your audience to take away today, if you're clenching and grinding your teeth and you don't have a neurologic problem like Parkinson's or tardive dyskinesia, or you don't have a parafunctional habit where you chew your fingernails or you bite pens, something's happening. That your body's going into fight or flight, and it's causing that kind of clench and grind. The analogy I use is you get in an Uber and you get out of the Uber and you think you left your phone in the Uber. What happens? You panic. You go into fight or flight, or what we call sympathetic overdrive. Your heart rate goes up, your blood pressure goes up, and you clench down. And if you think about it, how crappy that feels for 20 seconds, people with sleep apnea, your audience, that could be happening 200 times a night. That's why patients are on multiple meds for blood pressure. Everyone's getting a night guard. And kind of the device that my partner and I developed, it's really a better night guard. And the reason that you're talking to a dentist, unfortunately, people see their dentist doc more than they see their physician. And it's a captive audience because people go get their teeth cleaned. And when I lecture and I teach dentists, I'm like, if you see wear on someone's teeth and they don't have the problems I said, they have probably a bigger issue. And it's just about asking questions.
Yeah. Okay. I heard two really important things that you said. So the first one that I just want to point out because it's a really valuable piece. So here you are this, high powered Fifth Avenue, Manhattan dentist running an extraordinary practice. And then let me stop for a moment because you found this piece to be so powerful that you left your practice. What happened?
So a gentleman named Victor Avis that I taught with, who's a real significant mentor of mine in my life, we would discuss big dental cases. We'd meet once a month, we taught together, and he would look at people who had really broken down teeth, and he would be like, they probably have an airway or sleep issue. And I'm like, all right, I don't even know what he's talking about. And after about the 50th time, I'm like, all right, maybe there's something here. And he started to explain it to me. And what hit home was so many of the big cases I was doing. And I trained with amazing people. I have amazing mentors. I was in a very amazing dental practice on Fifth Avenue. And I had things failing on me. And they weren't major failures, but they were failures enough that I was like, I don't understand what's going on. And I realized that I made a lot of the patients worse without knowing I was making them worse. And I missed their problem. I was fixing a symptom. And I think I was pretty debilitated over it to the point that I did something drastic and sold my practice. But I loved dentistry. I love restorative dentistry. But what I'm doing now is such a bigger purpose. And when I lecture, I'm always saying I'm really blessed to not only impact people's lives, but to help dentists impact their patients' lives. So that's been a big part of it. And yeah, I think I did something drastic and maybe I wouldn't have done it the same way today as I did then, but I love the path I'm on. I get to meet amazing people like yourselves. I'm working with tons of healthcare providers. It's pretty amazing. And it's a huge problem. There's 90 million Americans right now that are undiagnosed with sleep apnea. So if someone watching your podcast is like, oh, you know what? I'm tired all the time. I'm clenching and grinding my teeth. I'm getting up to urinate a lot of times. I'm getting brain fog. Like, you really need to address it.
Yes. Yes. Yeah. I mean, for it to be so important for you to share the message, I think it's a big deal. So I hope everyone is listening very carefully. Okay. Because there's so much here that we need to talk about. So I love what you said. So a lot of your philosophy is sort of aligned with what I teach, right? So we got like the conventional medical model, which is like, here's the Band-Aid, put it on it. It serves a purpose in a function, right? If you have you have someone who's got a tooth breaking down, like it's got to be addressed. Someone comes in because they've had a terrible accident, like that stuff has to be addressed.
Absolutely.
But we've got to look at the underlying root causes of why different things are occurring. And this seems to be one that, the research and experience is indicating like, hey, we've been missing this for a very long time. And as you've said, and I know that you are really big on sleep. In fact, you have a pillow that you created to help people sleep. And I want you to talk about that. But if we're not sleeping, we're not healing and repairing, right? Our brain isn't going through its, detoxification in the middle of the night. Our body's not resting, or we're not detoxifying the way that we should. Like, it's a problem. So let's dive in. Let's talk about that sleep piece.
Yeah. And you brought up such a valid point. The glymphatic system, which kind of cleans our brain out of toxins and all gook. If you're not sleeping, you're not getting oxygen to that part of your brain to clean it out. And when we see kids, especially on the orthodontic side, ADD, ADHD, real cognitive and behavior issues, I'm always going right to airway and sleep.
Yes.
So if I see a kid that's struggling, they're 12, they look like they're 6, they're probably not producing growth hormone. My first referral ENT, pediatric ENT.
Yeah.
Second, a lot of times as a speech and language pathologist, looking at soft tissue, tongue ties, lip ties, and then right into early intervention orthodontics. I always say, like, orthodontics, yes, it's straightening teeth, but it's really about brain development. Your brain is almost fully developed by the age of 5. We need to get into these kids early. Now, on the adult side, it's brain fog, it's Alzheimer's, it's dementia. And, a perfect example, and I wanted to address this with you. I have a friend, she's 54 years old, she's postmenopausal, she's tired. She was somewhat in denial about like snoring and sleep apnea. Now, I knew she had a problem. She had a ton of wear on her teeth, which meant she was probably doing CPR on herself to keep her airway open.
Right.
And I sleep tested her, and her apnea hypopnea index, which is what we look at on the sleep side, was 21, which meant that she had moderate sleep apnea. And the biggest problem, Doc, is that her oxygen level, when we looked at her sleep test, was in the 70s, which is insane because if she was in a hospital, they'd put her on a ventilator.
Yes, they would.
So that, and I said to her, I'm like, Rach, this is Alzheimer's and dementia if you don't treat this.
Yeah.
And it's not to scare the audience. It's just that it could be something simple as your dentist looking at the wear on your teeth to just ask those questions. And I think that's kind of what our mission now is like, yeah, there's dental sleep medicine and there's incredible sleep dentists that are doing a lot of these devices, but really it's a night guard. If your dentist is prescribing a night guard for you, I want you to start asking questions. Hey, why do you think I need this?
Yes. Yeah. It's funny. I was just thinking as you're saying this, it's like, okay, so we're biohacking, we're getting in our cold plunge and we're doing our sauna and we're running marathons and we're meditating, but we're like, are we paying any attention to our sleep? Like stop, wait, freeze, pause before we do any of that stuff, which is, I mean, honestly, that stuff is kind of like icing on the cake. I tell my clients all the time, I'd rather you invest time in doing the real basic foundational stuff that moves the dial rather than, jump into a cold plunge. Would it be helpful? Sure. But if you're not sleeping, that cold plunge makes no difference whatsoever.
So I saw a new patient yesterday. I do concierge sleep here in Florida, and super nice guy, fit, 53, literally came in from a run. He's wearing a CPAP, which I love. If it's fit by a respiratory therapist, it's an amazing adjunct.
Sure.
But I wanted to sleep test him to figure out, like, all right, where is he? He hasn't had a sleep test in 10 years. Well, I had him not use his CPAP last night, and I sleep tested him. His apnea hypopnea index was 24, moderate sleep apnea. But he called me, and he's like, Layne, I really have a problem. He's like, I feel so awful today. And I looked at his sleep test, and I'm like, yep, your oxygen dropped here. So this is a real thing. It's a real problem. And if you're suffering, and the crazy thing is, I'm seeing so many fit postmenopausal women that are presenting the same way. And that's what a question was for you, is like, I'm seeing an uptick of this. Is it progesterone levels? Is it estrogen levels? What do you think is going on when I'm seeing a lot of these? It's not just, the problem is everyone thinks it's this like heavy set male Pickwickian fat person, and it's not.
Right. Yeah, that's really good. I mean, first of all, I think there's something to flag here, and that is all of these cases that you're talking about are the mild cases, right? It's kind of like if we equate it to blood work, they're like, well, we're not too concerned. You're just kind of like pre-diabetic. You're not fully diabetic. And so the moderate cases are just kind of be brushed aside. Meanwhile, the issue is getting exacerbated because it's not being addressed, right? And then so there's a whole lot on the hormonal side. And I want to be really careful because even in the hormonal world, in the perimenopausal, menopausal world, the first step is like, hey, let's go put them on a hormone, and that's the answer. Well, that comes with its own side effects. And then what, is that what your body really needs? And how do we actually address it? And one of the things that I often tell my clients, Dr. Martin, is that, you know, menopause is kind of like when the bill comes due. It's for most women, they've been raising families, they're in their careers, they're doing all these things, they're pushing, pushing, pushing. They live at the bottom of the list in terms of self-care. And so little things are just building up, building up, building up over time. And then it's like they get slammed. Like all of a sudden, perimenopause hits, the light gets shined down, and everything like now gets exacerbated, you know? And so if we look at stress, for example, and how that plays a role, and with women, you know, when we move into those perimenopausal, menopausal years, you know, it's been, you know, the ovaries have kind of taken care of everything and the hormones, but our backup is our adrenal glands. So now here's your sleep cycle. Here's where the sleep comes in really important, because if your adrenal glands are exhausted and they don't get the call that it's time for them to like kick in, well, now we have all these symptoms, hot flashes and brain fog and weight gain and mood swings and all of those things that come in. But now to your other point, right? If you're not sleeping during the night, well, guess what we're doing? We're just continuing to burn out those adrenal glands. And so now you're stuck in this really vicious cycle, you know? So again, it's getting to the underlying root cause.
Yeah, I mean, that's amazing, because right prior to this, I said I have so many women I want to refer to you, and they're coming to me because they're like, oh yeah, I got hormone replacement therapy. And half of them I feel like are getting it on the internet. It's like peptides now, right? Like
Yeah,
that's like the Wild West too. And, you know, but it adds to so many of the patients I'm seeing are taking sleep aids, from Ambien to, you know, all these other adjuncts that I'm like, no, that is a terrible idea, you know, to take. We just need to figure out what's going on, because to your point, they're just putting a Band-Aid on it. And, you know, that's so much of what we're doing is, I mean, myself included. I developed a mouthpiece. I have a pillow. They're great adjuncts, but I'm still fixing a symptom, where you and I had the conversation even with your kids. I'm like, the beauty of dentistry is it could really help assist you guys on the medical side of treating a medical condition like snoring, sleep apnea, upper airway
yes.
resistance syndrome. Because what could we do? We could help someone's lower jaw get in a better position, whether it's
Mm-hmm.
using orthodontics, using dentistry, addressing a lot of the anatomical issues, because it really is multifactorial. Could you breathe through your nose? Do you have a soft tissue problem, and is it anatomical? So where the anatomical part, you guys are the beginning part of that.
Yeah, absolutely. Absolutely. Everything goes hand in hand. And it's funny, you know, we even talk about, so in terms of dentistry, I mean, dental infections are a real cause of health issues. And, you know, we've had different people, you know, on the podcast to talk about some of the dental stuff and mercury and root canals and all of those other things as well. But, you know, a hidden dental infection, which happens more often than not, can cause pretty severe issues and symptoms. And we've got to be looking at what's happening in the mouth. And now we want to include that airway piece in there. So let me ask you a question. How does someone suspect that maybe they need to find someone to get some help with their airway? So you've mentioned clenching, you've mentioned grinding. What else?
You know, I think it's things like brain fog. I
Mm-hmm.
think it's if you're on multiple meds for blood pressure, where, you know, your blood pressure is not being controlled very well. It's things like that. Like I said, you brought up the clenching and grinding. That's the simplest thing for a dentist, and even for us to look at. Even things of looking at faces now. You know, there's certain angles like under your chin, under your nose, that we could look at, even to try to figure out, like, is that person going to be prone to an airway issue? Even my ortho program in Hoboken called CTOR, we're starting to use a company called SonuSense, where you take an image with your phone and it literally creates like a 3D model of your face. And we could even,
I've
look
got
at
one.
that. Oh my God. I was just on with them this morning. They're great. I use this every day. It's one of the adjuncts I give to every patient.
That's amazing.
That's
Yeah.
so
So
funny. It's acoustic resonance therapy for nasal patency.
yes.
That's
Yeah.
so funny.
Yeah.
But they're coming out with an amazing app on the phone. So, because a lot of times what we'll do is in dentistry now, there's a procedure called MARPE where it's skeletal expansion for your upper jaw. So the roof of your mouth is the floor of your nose. And if you expand the child, even an adult, you can really improve a lot of things like nasal patency and breathing. But how do you track that? And using that company's Sonu Sense and tracking it with phonetics is a great way for us to do it, better than taking x-rays and looking at like nasal volume. So, could you breathe through your nose? Are you having problems breathing? Are you anxious? Like for me, I'm anxious, very. I meditate, I do martial arts, but even like a couple of years ago, my fingers were tingling. And I was like, oh, am I having a circulatory issue? Is it Raynaud's? And my physician's like, no, you're perfusing fine. And I realized my body is constantly in sympathetic. I'm constantly in fight or flight. So when my body's in fight or flight, what happens? It depletes blood flow and oxygen from my extremities, and it goes to my heart and my brain. So, things like acid reflux. I ask every patient, do you have acid reflux? Do you have things like silent reflux where you're like always having to clear your throat? A lot of times that's inflammatory. You sleep on your back, your tongue falls back. So I think it's so many things. Are you aware that you snore, right? Like to me, there's no such thing as benign snoring, especially in kids. If I see a kid that's snoring or grinding their teeth, that to me right away is an airway issue. No child should snore or grind their teeth.
Yes.
Adults shouldn't either, but it's alarming when I see a child that's doing it.
Yeah. And I've got, like I said, I've got my 3 kids and getting taken care of. I probably need to have the 4th one looked at, but she's, in college, a little more complicated to make those arrangements. But yeah, we got to start in kids. A lot of our audience, though, they have kids, but now they're adults. So what can they do as adults?
I mean, I would say the first thing is either see your primary care physician, see someone like yourself to evaluate their sleep. Right now, especially post-COVID, not many people are going in and sleeping in a sleep lab. Unless you have things like restless leg syndrome or things like central sleep apnea, everyone else is getting tested from home. And it's something as easy as wearing it on your finger. It almost looks like a pulse oximeter. And that's what I gave to the patient last night. So within a day, I already had his report this morning to see his numbers, his SpO2. So even getting sleep tested, that's the first thing out of the gate. I test everyone. Anyone that walks through that door, they're going to either get a sleep test or they're definitely going to get a device from me, because the whole premise also is when you go to sleep at night, a lot of times what happens is, especially if you sleep on your back, your jaw falls back and it rotates clockwise. And what it does is it brings your tongue with it. And that's what causes a lot of snoring or apneic events. So the device that we created is literally like retainers with a band on it.
Okay.
And it literally is this. It looks like this.
So for those of you who are watching, for those of you who are not, we'll put a link to the Ayurveda in the show notes, and then you can see what it looks like.
And you can see it's super flexible. It's literally like wearing Invisalign with like a little connector on it. And something as simple as that could impact someone's airway and breathing. Because that's what I do. When I talk to a physician like yourself, I'm never like, hey, this could replace CPAP. They could wear this with a CPAP. And I was just on with a podcast this morning, and I said, any patient that's either on CPAP, they're getting a single arch night guard, so it's either upper or lower, not both, or they're in retainers, their jaw's going to fall back and rotate clockwise. So I would argue anyone over the age of 35 needs that device. It just prevents their jaw from falling back at night. It mimics mouth taping. I get asked
Oh,
about
okay.
mouth taping all the time. What's the
Sure.
premise of mouth taping? It's to keep your mouth closed and to prevent your jaw from falling back.
Right. 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 So this is a lot more comfortable than doing that.
Well, the only type of mouth tape you should use if you put tape around your mouth or maybe one piece across. But I have
Mhm.
patients that are coming in that are in their 50s that are like, oh, yeah, I use tape, mouth tape, and they're taping over their mouth. And I'm like, that is a terrible idea. You need to be able to puff breathe. If your oxygen goes down, you need to be able to breathe out. And if you can't,
Yes.
it'll cause a heart rate and blood pressure spike.
Yes. 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 So with the Ayurveda, they can actually
Here, I
breathe
have mine.
while they're
So
sleeping.
I was a sick kid that became a sick adult. I had bad orthodontics. I had ADD. I was 5'2" up until 12th grade of high school. I didn't
Yeah.
grow. And like I said, sick kid became sick adult. Nasal
Yes.
issues, sinus problems. So this is my device.
Yes.
It goes on my teeth. I can get my lips together. I can move my jaw side to side. I have enough tongue space, but my jaw can't fall back. And I can have a conversation. And it's super comfortable.
Right. Love it.
Yeah.
I love it. So wait, so where can people, so obviously they can go to airvada.com, but where would they find one? Is this something
Yeah,
they
they're
can
dentists.
order?
We have dentists pretty much in all 50 states, and you could give everyone my email, my cell phone number. If you want to get one, I could help you find a dentist in your area. And we're a startup, so along with it is we're really about getting feedback. We've mitigated a lot of the risk with these devices because if you Google things about mandibular advancement devices or sleep devices, you're going to see a lot of things like, oh, it could change your bite. It could exacerbate people with a TMJ problem. Well, traditional ones, yes, we mitigated a lot of those risks. So ours is just, it puts you in your normal bite and it just prevents you from falling back.
Yeah. I love that. I
Yeah.
love that.
And
So
especially as me being someone that worries and has anxiety, I had to look at it like, all right, I need to protect all of our doctors that are doing this and also mitigate things that could happen to their patients.
yeah. Yeah. We want to get them better. We don't want to
No.
create any
And,
additional issues. Yeah.
and the problem where I see this a lot is if someone does have a bite change where if they bring their jaw edge to edge, their back teeth might not touch. Well,
Mm,
I was with a dentist last week and she's like, yeah, but you know what? They're feeling better. But I'm like, no, your brain needs the feedback of your teeth to touch.
right.
So, that's one thing. You can't, yes, you are going to treat their airway and sleep. But even last week, I saw a gentleman who has a device. He's worn it for 5 years. His teeth don't touch. His teeth touch on one tooth. And his jaw used to look like this, where we call this like a little bit class 2, where his lower jaw was further back. Now he's edge to edge. Well, the device is so thick that his apnea hypopnea index was actually higher with the device than without it. He was
Oh,
mouth
wow.
breathing the whole night.
Wow.
And mouth
Wow.
breathing is a huge problem now. Your
Okay.
mouth serves no purpose for breathing. It just creates obstacles. You got to be able to breathe through your nose.
Well, let's talk about that because people assume that you could or should be able to breathe through your mouth. So, what you're saying is when people are sleeping or even just kind of randomly during the day, their mouths should be closed and most of that breathing should be through your nose, which makes sense, right? You've got more filtration there in your nose than in your
Absolutely.
mouth. But walk us through how that works more.
So basically what happens is you're a mouth breather. There's a lot of obstacles. The front line of defense a lot of times is tonsils and adenoids. You're sucking in gook. Those get inflamed. If you breathe through your nose, to your point, it filters the air, it humidifies the air, but it also produces something called nitric oxide, not nitrous oxide, nitric. And what that does is, and you could probably talk to it because I know you and I have spoken about this, it just increases the perfusion to your blood vessels. And,
Yes.
it's what people that drink beet juice, eat beets, that's really what it's doing. It's just improving blood flow so much. So it really helps out breathing through your nose. Also, it's a way more efficient way to breathe. Like I've run marathons. I will never run 1 mile as fast as the people that win the marathon average 26.2 miles. They run 4-minute miles. But if you watch them run, they're all running with their mouths closed. They're super efficient breathers.
Yeah. So that's our goal. Our goal is ideally to be a super efficient breather, because that's going to, let's talk about what the health benefits of that are. So I know we kind of touched on some of the symptoms and things like that, but someone who is efficiently breathing through their mouth, why is that important? What does it allow for?
I mean, in kids, it's facial development. I mean, I see these kids that are coming in that are mouth breathers, and they go from growing horizontally like this to now growing vertically. And now their lower jaw's too far back, you know, their septum's deviated. It creates tons of developmental problems, mouth breathing. So that's why I said, like, if you have a child that is, you know, snoring, they're maybe not growing, they're not thriving, you really should take them to a pediatric ENT and look at that. Like, we saw a case 2 weeks ago at my ortho program. We're building a fellowship there, and for sleep, and I saw a young lady, and she was completely occluded on one side of her sinus, and she just didn't develop properly. And my friend VJ, who's an ENT here, you know, first we were like, all right, is it like, you know, a cancerous lesion? It's not, but those are things that happen when you're mouth breathing. Like it's a downhill problem.
Right. So talk to me about the position in which we sleep and how that impacts our breathing at night, because I know that plays a role, and everyone's always, you know, there's this, whatever's trending on TikTok or whatever becomes like the new theme. But I think you look at what these trends are from a much different perspective in terms of airways. So how should we be sleeping?
Yeah, so every patient that I see normally gets, first I sleep test them. So I get a baseline and I want to see where they're at. And then I treat them. I give them, a lot of times it's just adjuncts that are basically addressing symptoms. So I give them a mouthpiece. I give them the Sonu headband. I give them respiratory muscle strain training. And I do give them a pillow now for positional therapy. The reason we developed the pillow is I was treating a lot of patients that were either getting our mouthpiece or they were getting a CPAP. And a lot of those patients were doing well, except when they ended up on their back, which is like the worst position to sleep in because your tongue falls back. The way you should sleep is you should sleep on your left side if you're pregnant or things like acid reflux, your right side if you have cardiovascular issues. You really need to sleep on your side. But the problem is, when I started this journey, I would literally have people sleeping on their side. My partner, whose name is JD Valella, he was with Sealy Serta and then Tuft and Needle, their pillow mattress companies, and he coaches CEOs and celebrities on like sleep position. And he was like, no, they can't sleep here. They almost have to kind of sleep on an angle. And what it does is it opens their airway, it opens up their hips and their chest, and also we have them put a pillow between their knees and their ankles. And the pillow we developed literally was like a fulcrum. So when the head part of the pillow goes down, the back part pops up. And I tried all this weird stuff, and we ended up putting a chamber between the head and the back part. And yeah, it's been amazing. So every patient I see, I give them a mouthpiece, I give them a pillow. The other crazy thing is, has anyone ever taught you how to sleep in a bed? No.
No, you just lay down, don't you?
Well, you spend a third of your life in a bed. So a lot of what I do is educating patients. Like, I will get on the floor, I will take our pillow, right?
And can you just tell our audience, we'll have it in the show notes.
Yep.
But open air pillow is the name of the pillow.
Yeah. And I'll get on the floor and I'll literally show them the position to sleep in. Right. And there's videos on our website, and yeah, it's been amazing. And again, everyone's not going to be a responder to all these adjuncts. That's why we have to figure out, like, where are they struggling? Are they having, you know, are their muscles in the back of their throat not working? So I work with a speech and language pathologist on that, because so much of me giving someone our mouthpiece, a lot of it's guesswork. Unless
Yes.
someone's collapsing front to back, our mouthpiece will work well. Something like what's called Inspire, which is hypoglossal nerve stimulation, that'll work well. But if someone's airway collapses on the side, they might need CPAP.
Mm-hmm.
You know, and unless someone has what's called a drug-induced sleep endoscopy, that's the only way to really see where their airway is collapsing.
Okay. But
The
luckily, we
position,
don't have to start there.
no, and you don't. But I'm saying, like, what we're doing is a conservative treatment. I mean, I would love everyone to get our mouthpiece. Everyone doesn't have the luxury to go to the doctor and the dentist. The pillow has been amazing because everyone's sleeping on a pillow, and we've sleep tested people, so we have objective data showing, hey, we've gotten people to stop snoring or have apnea from a pillow. Now, is that going to be everyone? Probably
Right.
not, but it's going to at least put them in an optimal position to keep their airway open, or at least try to keep their airway open.
Yes, I know we all use your pillow in our house. So because we want to have the best sleep, and we want, people have to understand that all of these little things, they all make a difference in what the trajectory of our health looks like and what our longevity looks like. So yeah, there's debate and controversy of, where we might be living a little longer, but the quality of our life is not good. And that quality of life is going down at a younger and younger age. So, I mean, who wants to be 70 years old and not have their mind? But that's part of what's happening, for example, if we're not getting the proper sleep that we actually need. And for some people, it's not about just not getting in bed. It's about, I'm not getting in bed and I'm not sleeping.
Yeah, and I think that's a great point. I mean, I sleep right now probably 6 hours. I wish I slept more. But the 6 hours is efficient. I wear our mouthpiece. I use nasal dilators, which I give like a nasal patency protocol to every patient. I
Yes.
use our pillow. I use the Sonu headband twice a day. So, like,
Yes.
I'm really trying to hack my sleep. At 53, I definitely have that, where the back of my throat doesn't work the same way as if I was 30. So
Right.
I don't have sleep apnea. I have what's called upper airway resistance syndrome. 2 years ago, I was snoring. I was tired. I definitely was getting brain fog. The problem is this. I took a sleep test. My number was 1.8, which meant that according to the insurance company, I was fine. And I'm like, I am definitely not fine. So yes, I sleep test people. We have to for insurance purposes, but every single patient that's walking through my door, they're getting treated.
Yeah. Yeah. It's that important.
Yep.
Yeah. What are some of the common things that you see happening with people who are not sleeping well and don't even realize that they're not sleeping well?
So we go back to it. I would say it's comorbidities, hypertension, AFib, heart attacks.
Mm-hmm.
It's Alzheimer's. It's probably diabetes, and
Mm-hmm.
things like, a lot of times I try to meet people where they're at. And I could talk about all these things to people, and some of the people are like, yeah, whatever, right? But what is impactful to them, I will tell you this. For men, erectile dysfunction. And one of
Sure.
the biggest causes is sleep apnea.
Sure.
In women, it's weight loss.
Yes.
I see so many women that are even premenopausal that are working out 6-7 days a week, and they're like, I can't lose weight, and they're eating healthy. And as soon as I look at their face, I'm like, you need orthodontics and you need to treat your sleep, because it goes to other things like leptin and ghrelin, where it's the hormones that control
Yes.
satiated
Appetite.
appetite. Mm-hmm. So I think that's a lot of times where if I can't really get through to someone and I know they're having a problem, I kind of go there. I'm like, what's going to be meaningful to this person? Do they want to look younger? Do they want to, not to your point, do they want to live longer, but not just live longer, live better?
Right. Exactly.
So,
exactly.
yeah, but it's so many of these comorbidities, because you can go into a hospital, it's heart failure. Mm-hmm. It's not on a death, sleep apnea is not on a death certificate.
Right.
But if I gave you the analogy with the phone, or even sometimes I talk about like speeding and you're going past the cop and you look in your rear view mirror and you see the lights on, you're like, oh my God, I'm getting pulled over. For me, that gives me crazy anxiety.
Sure.
And my body goes into fight or flight. But that's happening potentially 200 times a night to a person. That's why people are dying of heart attacks a lot of times in the morning.
Mm-hmm. Puts it into perspective, doesn't it? Oh my gosh.
Yeah. And it's a crappy feeling. So like my dad's a perfect example. He has sleep apnea. He has silent reflux. So he's always like clearing his throat. Well,
sure.
2 years ago, had a physical, they're like, you're fine. Well, this is the other problem. Like no one's ever done a heart scan on him or a carotid ultrasound. So I send a lot of my patients for that. So he has his physical EKG. They're like, you're fine. Well, 2 weeks later, he has terrible back pain, goes to his physician. The physician was astute enough to be like, something's not right. Well, my dad ended up with double bypass surgery 2 days later.
Oh, gosh.
He had 95% blockage in his right coronary, and he had a physical 2 weeks before that.
Right.
And his sleep apnea is, granted he was a cigarette smoker, so they couldn't put a stent in him, but a lot of it was putting so much stress on his heart from the sleep apnea that, that muscle just got really weak.
Yeah. 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 Well, I'm so grateful that you're bringing our awareness to what this is and how it impacts us. Is there anything else our audience should know?
I think just if you're a patient or you're someone like myself that's been clenching and grinding your teeth for a long time, I want you to think about it, and I want you to address it with your dentist the next time you go in. And just say like, hey, I saw a podcast, or I've kind of done some research showing like, people that teeth look like mine, maybe there's an airway issue or a sleep issue going on. And then it's just asking questions. I mean, I think that so much of what I did as a dentist was about procedures, and I never looked at what you guys do. And it's more about asking questions. And I think that's what we need to do now. And listen, every dentist is not going to treat sleep, but every dentist, like I always give the analogy, we screen people for oral cancer. I'm not treating oral cancer, but at least need to screen for it.
Sure.
The dentist needs to screen for this.
Sure.
If that patient's presenting with that type of wear, high vaulted palate, things like that we're seeing on the dental side, you got to have the conversation with the patient.
Absolutely. Absolutely. Well, thank you so much for being here with us. Can you share with everyone the websites for the pillow, for the Airway?
Yeah, so our website for our pillow is called Open Air Pillow. And our website for our mouthpiece is called Airvada. I can show you real quick, what that looks like. That's kind of our brand, Airvada. And I can give you everyone my email address is LMARTIN@AIRVATA.com. And then my cell phone number, 917-748-0816. Any questions, let me know. If you're interested in getting any of the products, as much as I could help, I will. And if I can get you in the right direction, even one of our providers, or if you have a dentist that wants to become a provider, have them reach out as well.
Awesome. And everyone, we'll have that in the show notes, so you can go ahead and click right on those links and send Dr. Martin an email. Thank you so much. That's so generous to be able to open that up for our audience and our listeners. People just don't do that anymore, but we forget that we're like, relationship human beings.
Yeah, totally.
So Thank you for your generosity, for your time, for your wisdom, for your knowledge. And we'll see you next time, everyone.
This is Dr. Z reminding you to tune into your body, connect with what matters, and embrace your journey to true wellness. If you enjoyed today's episode, be sure to subscribe, leave a review, and share this with someone who's ready to redefine their health. Let's keep redefining wellness and empowering change together. See you for the next episode.